Hi, in this video I'd like to discuss a very common diagnosis that a lot of women get but don't really understand what exactly it is. This diagnosis is CIN, which is Cervical Intraepithelial Neoplasia. Now it looks very complicated, but the concept is very simple. Now let's look at the diagram here. From the left to the right, we can see that I've already separated and graded each column. So this is the cervical membrane or cervical epithelial, which is the skin of the cervix from top to bottom, and it has two significant layers. The big bunch of it is the epithelial cervix, epithelial of the cervix. At the very bottom is known as the basal membrane. Now keep these two keywords in mind, and then we can see that if you're diagnosed with CIN1, it means that only less than 1/3 of your cervical epithelium is affected with these infected cells. If CIN2, it means that less than 2/3 of your cervical epithelium is infected. As you can see the diagram, the infection gets worse towards the right. So CIN3 is that almost the entire cervical epithelium is infected. And next one is the carcinoma in situ, which means the entire epithelium is infected, which means each cell is infected with the HPV that is causing this cervical intraepithelial neoplasia. The final stage is when the infected cells penetrate into the basal membrane, as you can see. Once it starts penetrating, then we can call this cancer. Before that, CIN1, 2, 3, and carcinoma in situ is not considered cancer. It's only considered pre-cancer lesions. If you are diagnosed to be in these stages, there is hope for you. There is treatment available, but you need to act quickly before it develops into carcinoma, where treatment is less viable and we cannot prevent it from turning into full-on cancer and spreading. So here at the hospital, how do we treat this condition is that first we need you to do a pap test and also a colposcopy to confirm that you are indeed CIN1, 2, 3 or carcinoma in situ. We do not treat carcinoma stage. Treatment includes applying our Antai, which is our proprietary medication, on the affected regions of the epithelium. Once the medication is already applied, the affected cells will peel off, revealing healthy cells beneath, which will grow and cover up the removed areas. Furthermore, we also need you to take some oral medication that will prevent the relapse of these HPV infected cells. Within 1 to 3 months, we can confirm that your HPV positive can turn into HPV negative, and your CIN diagnosis will not develop further anymore. So if you'd like to find out more information about CIN, HPV infection, and how it can lead to cervical cancer, please visit our website and also leave me a comment down below.